Mm, There, am I audible to you?
Yes.
Okay, let's begin the session with the name of Allah. Bismillahir Rahmanir Rahim. Assalamu alaikum. And a very good evening to everybody. Hope you all are doing very well and having a productive day out there. So we all session. I'm Nazish Mohammed Arif, a recent graduate in food science and technology. My academic journey has cultivated a deep passion for quality assurance, certifications, and adherence to halal standards and HACCP. I have been actively participated in various sessions and training programs to enhance my expertise in ensuring top-notch quality in the food industry. This is all about myself. Let's begin the session. Let me first share the screen so that you can easily understand
Yeah, we can
about. It is requested to all the participants to mute their mics during the session, and it is also a request if they are facing any kind of query or is there a question regarding the session. So put it down or pen it down. Obviously, we will inshallah discuss in the at the end of this session. So let's move ahead with the HACCP. First of all, what is HACCP? HACCP is basically an acronym of Hazard Analysis Critical Control Point. Before getting into the main session or main topic, let's get touch about the little bit history of HACCP. So HACCP is a system that was introduced in 1960. It is actually joint collaboration of NASA and Pillsbury in 1960 for one of the US space research program where NASA was ensuring that our astronauts uh, must have conduct a safe food with them in the space. So NASA required a zero risk product for their astronauts. So HACCP has been designed to reduce food safety hazards to a minimum level. Very well known about that millions of people get sick due to foodborne illnesses every year. It has been reported in many research papers and research programs, and thousands of them were died due to some of the hazardous material that contaminate the food supply chain. That all can also cost companies millions of dollars, cost loss and untold damage to their revenue also. So as a result, food safety became an important issue in all stages of food processing industries, from growers, you can say from growers to manufacturers to distributors and all the retailers out there to address their problems over the years. And a number of food safety programs have that reaches to the consumers is in fact a safe enough to eat. So the most widely nationally and internationally, this awareness session is all about. Let's move for definition of HACCP. Wait for a while. Yeah, sorry for the disruption. Okay, HACCP is basically a continuous process with the adjustment is being made as things change within the food processing facility. HACCP is a systematic preventive approach to food safety from biological, chemical, and physical hazards in production process, from raw material and consumption of the finished product. It is basically a method of identification, or you can say identifying the hazards in the production of the food and implementing control measures to prevent, eliminate, or to reduce these hazards to acceptable level. Uh, to build and implement a
दो
HACCP
मिस कॉल लो, 2 मिस कॉल बस यार कॉल यार बिल डाला वालेकुम सलाम
to build that prerequisite programs are and to build and implement the HACCP plan, a HACCP system requires some of the prerequisites program and HACCP plans to implement in a better way. So anybody out there would like to answer what in a very short way, or what is the basic definition of PRP? Any participant who can answer this question or who would like to share some of the input from his or her side? Do you know what are PRPs and what is the basic definition of PRPs, or uh, what in short you can answer in a very short way, or the basic concept of PRPs? Yes, you are right. Prerequisite programs are there. What is the basic definition? Anyone who can answer this question? Okay, no problem at all. Let me answer the question first, because prerequisite program are the core part of the HACCP plan. Programs that are put in place in the company to control, you can say, to control hazards in the environment and preventing contamination of the product. PRPs provide you with the hygienic environment, operating conditions, and GMPs that are called good manufacturing practices for the personnel. Personnel are the staff, or you can say the people working in the production line, in the manufacturing department, in the packaging department, in the receiving area, or in any department of the food facility. Operating conditions and GMPs for personnel that can reduce the risk of contamination of the food product. Let's discuss some of the few PRPs that are involved in the food facility during the implementation of HACCP plan. These PRPs may include cleaning and sanitation processes, personal hygiene of the staff, programs, pest control programs, the conditions of the receiving area, storage area, the supplier controls, and the trainings. All these include, or you can say that all these come under the umbrella of the word PRPs, or prerequisite programs. So here is the slide that is telling about what does the HACCP plan actually involve. This is one of the most easiest slide. You can read by yourselves. If you face to ask So I'm providing you with a minute or two. You can go through with the slide and ask in the chat box. If you face any kind of difficulty, then we will move forward. Okay, the last point is about the record keeping procedures, that reviewing the HACCP plan whenever the food operation is altered. It means uh, the after the implementation of the HACCP, we will discuss in the later in the next slides too. But here is for your removing your confusion. Okay, so reviewing the HACCP plan whenever the food operation is altered, for it means that if any kind of changes are made in the food operations, or you have to review your HACCP plan, or all kinds of processes, all kind of CCPs, all kind of critical limits in your HACCP plan that you have implemented in the HACCP plan on the regular basis. Either the alterations are made, or either there are no changes made. This is the core responsibility of the HACCP team, or the person who have been assigned as a reviewer or as a manager to uh, perform the task of the reviewing operations. So it is the core responsibility of that specific person to review the HACCP plan, either it work properly or not. Hope you get my point. Is there any confusion now, or we have to move forward? Okay with this slide? So I think there are no more confusions. Let's move forward. Okay, this slide is about the qualities of the HACCP system. It means the significance of the HACCP system. This one's also an easy slide. All the benefits are included in this slide. HACCP system. The first point is systematic. HACCP system is a very systematic system in which you can identify potential hazards before the problem arise. Second one is the efficiency of the system, that it concentrates the control effort at the stages where the risk is potentially at its highest rate or on the spot. The third one is on the spot. It means the HACCP system is a very immediate system that can control the processes within the food production line on immediate basis. It is also something like how HACCP help the food industries by minimizing the contamination and hazards to the customer end. Okay, so it is about hazards. We are talking from very first slides. That hazard analysis, critical control point. The first word, hazard. What is hazard? What does it mean? What things are included in hazards? How many kind of hazards are there? Let let me discuss with you all the points in a very calm manner. Okay. So hazards are those I can say those contaminants, those compounds uh, those compounds that can cause any kind of injury or illness to you by consuming the food is all about hazard. And what are hazard? Hazards may be of three types. Number first, biological hazards. Number second, chemical hazards. Number third, physical hazards, and this may also include allergens. So, biological hazards may include viruses, bacteria like E. coli, Listeria, you can say Salmonella, or any kind of fungus, molds, parasites. All these includes all the harmful microorganisms are included in the biological hazards. When it comes to physical hazards, broken glasses, mm, physical hazards are basically hard all the contaminants or all the things that are having very hard structure. Broken glass, metal fragments, you can see pieces of plastics and stones, any kind of extraneous matter comes under the category of physical hazards. Let's move towards the chemical hazards. Chemical hazards are those hazards that can be get into your food either intentionally or unintentionally, like cleaning cleaning solutions, you can say pesticides, you can say, and even the allergens like peanut dusts, or if you are working in the facility that deals with the gluten uh, products having gluten or products having lactose in it. So all comes under the category of chemical hazards. Let's move a little forward. Critical control points, that are CCP, that is the second main part of our session, hazard analysis, critical control point. So we are getting into the critical control point now. What are critical control points? So critical, I will try to give you a very simple definitions. Critical control points are those points where there are chances of hazards to be occur within the production chain, not during only production, not during only formulation. For example, if you are working in a biscuit manufacturing industry, so it is not necessary that you are facing, or the critical control point only come when you are mixing the ingredients, or you can say when you are baking the biscuits, or you can say when you are baking the cake, or you can say when you are packaging the cake. Critical control points are those where there are chances of hazards to be occur within the production chain, throughout the production chain. So to take control over these actions, or certain steps are taken that are called corrective or preventive actions. And here the confusion begins. Many students are there that got confused between the two main terminologies, like that is corrective action and preventive action. Those who are answering in the chat box, they are answering very good. They are answering in a very good manner, and they are very close to the questions. And I like to appreciate them that they are getting in touch with they are getting very good knowledge about the HACCP and its implementations in the food industry. Much appreciated, all the participants. Keep participating. Okay, so I were talking about that what is the difference between the corrective action and preventive action. Is there anyone who can answer a very accurate, or who can answer what is the basic difference between the corrective and preventive action? Is there anyone who can answer the difference between
Corrective action is applied when the hazard is occurred, after the hazard is occurred, and before the hazard is occurred. If we apply the steps, that is known as preventive actions. That action known as preventive action.
Sorry for the interruption. I think there are some kind of technical problems with my internet. Let me share the screen first. Those who are answering in the chat box, they are giving a very good try. I am appreciating their efforts. Keep going, students. You are going very well. Sarah BB, yes, you are very correct. Corrective action are the actions that take after, and preventive those that take before. Let me discuss in a very proper manner. So corrective actions are those actions that addresses existing issues to eliminate the causes. Okay, while preventive actions aims to proactively avoid the occurrence of potential problems in the future. Sorry, participants. I think there is a problem in sharing screen. I am trying to share screen with you. Give me a few minutes. So, okay, everyone is able to look up on the screen. Can everyone see the screen now? Okay, let's move forward. So we were discussing about the critical control points. I think you all are now got the difference between the corrective action and preventive action, and I think there is no more confusion between the corrective and preventive action from now onwards, inshallah. But still, if anyone is not clear with the corrective and preventive action, because in the very next slides we will discuss the corrective actions, so please let me know if you still face any kind of difficulty in between corrective and preventive actions. So I will make sure to remove your confusion. Okay, let's move further. So it is important to understand what HESAB does and does not do. HESAB addresses food safety by focusing on the processes that food is going through, such as from the very first step, like from the receiving till the storage and the distribution. It is the whole supply chain, whole food supply chain, where HACCP has been implemented, not only on the cooking steps, or you can say not only in the storage area, or you can say not only in the implemented, that should have been implemented in the food industry chain. So here are the 7 we'll discuss very next slides, inshallah. So okay, let's start with the very first step. The first is to conduct hazard. The very first step is to conduct steps in the process where physical, chemical, or biological contaminants could be introduced in the food. So it is very important to look at the entire process or supply chain or a flow chain during the analysis, from receipt, I mean from final distribution step. So as we already discussed about hazards in detail, how many kinds of hazards, how many types of hazards, and what kind of things are included in such hazards. So in this step, conducting the hazard analysis, you will need to make an accurate evaluation of the hazards. The hazards identification. Number one step is identifying or identification of hazard. Okay, the sorry for the disruption. We have been discussing that there are the two major steps in which identification. Number one is identification of hazards itself, that have been discussed in the later slides, that what kind, whether it is a chemical. The second step is to evaluate the hazards. Evaluation of hazards. What is the evaluation of hazards? Evaluation of hazards means, while evaluation in degree of risk to the user. What the degree of risk to the user from the has been caused some damage to the product. Once the hazard is identified, once the hazard have been identified and evaluated, the team must identify critical control points now. So, what are critical control? Critical control points uh, are the points where hazard must be controlled or okay. Let's move towards our next principle, that is determination the critical control points, CCPs. Determination of critical control points, you can say, are a step at which control can be applied, and it is essential to prevent or eliminate a food safety hazard, or you can say that to reduce it to an acceptable level. So for each CCP, you will need to identify the preventive measure, and there is a separate preventive action for each CCP. It is not all the preventive actions can be applicable to all CCPs, or all CCPs can be in same preventive action. Okay. Let's discuss some of the examples to make you better understand the CCPs. What are CCPs, or where can we implement CCPs, or what are the procedures that can be considered as processing, for example, chilling, for example, testing of ingredients for chemical residues to detect any kind of metal contamination, or you can is the CCP point when you are. So, by understanding all the CCPs, there is a through these CCPs. So the answer is very specific ranges of temperature, pH, time, and are the easiest way to control or to prevent the hazards through these CCPs. Number third principle is about the establishing critical limits. What is critical limit is the major thing that is the major confusion that got stuck in the mind of students. The students also got confused between control. Here's the example. Here's the proper definition. It written in the slide too. Uh, a critical limit is a maximum or minimum value to which a biological, chemical, or physical limit must be controlled at a CCP to prevent, to eliminate, or to reduce to it into an acceptable level of occurrence of food safety hazard. For example, establishing a maximum or minimum limit for temperature, for time, for percentage of humidity, for concentration of your product. If you, for example, if you are working in any kind of sauce industry or any kind of condiments, like you can say if you are working in a ketchup industry, so the viscosity is the major parameter that you have to set a critical limit for. The other critical limits may include the ranges of pH, the ranges of salt levels. You can say about chlorine levels in the product, or any kind of other processing characteristics that will involve in controlling the hazards. So this is all about critical limits of CCPs. Fourth, moving towards the fourth principle, that is about monitoring the critical control points. So monitoring is about establishing a system to monitor and to control, or to take a control of the CCP, or you can say a planned series of observation or measurements need to be taken or to assess whether a CCP is within the set critical limits or not. So this also helps to produce an accurate record for future use in the verification process. What we include during monitoring. Number first is, what will you measure? How will you measure it? Can you do a continuous monitoring of control points? These all are points include during the monitoring of the critical control limits. If you do not do a continuous monitoring, so it is the question, how often will the measurements need to be performed to show that the process is under control? So the monitoring that takes place at critical control points is essential for the effectiveness of the HACCP program. The monitoring program will be made up of physical measurements or observations that can be done in a timely manner to provide the information in a time frame, like that allows you to take action and control product if you are facing an out of control situation. Okay. Okay, the fifth actions that we have discussed in the previous slide. What are corrective actions? Establishing corrective actions to be taken when monitoring indicates that a particular CCP subsystem is basically designed to identify health hazards and to establish strategies to prevent, to eliminate, or to reduce the occurrence of the hazards. However, deviation from established processes may occur. So whenever there is a critical limits, corrective actions are made or corrective actions are necessary that will be identified ahead of time for each CCP. So the action must make sure to determine and correct the cause of any kind of non-compliance or non-conformities, or to determine the disposition of non-conformities or non-compliance of the product, and make sure that no unsafe product is released, and the record of the corrective action that have been taken is mandatory part. So you must have to keep one thing in your mind, that the actions or the activities that have been taken are taken for two purposes. Number first purpose is to control any non-conforming product resulting from the loss of control. What is the first thing? There are two purposes of the corrective action. Number one purpose is to control any non-conforming product resulting from loss of control, and the second one is to identify the cause, eliminate it, and to prevent the situation from reoccurring. These are the two main purposes. Those who are asking in the chat box, kindly wait till end of the session. We will this session. Main purposes of the corrective actions, why corrective actions are needed to be taken. So corrective actions are needed first of all to control any non-conforming product resulting from the loss of control, and the second one to identify the cause, to eliminate it, and to prevent the situation from reoccurrence. So by identifying the corrective action occurs, you are prepared to take action quickly if any kind of situation can occur. Okay, so moving towards the next slide, that is establishing verification procedures. Establishing procedures to confirm that HACCP system is working effectively or not. Verification is the activities that help you to identify that what that the procedures that have been implemented or the plan that have been implemented either working properly or not. It is all about the verification. The HACCP plan must be validated. Once the plan is in place, we need to make sure that it is effective in preventing the hazards that have been identified during the process. An effective HACCP system requires little and product testings and verify that the controls are working as planned. After easily identified that the controls that have been applied, that have been implemented during the procedure are correctively applied in accordance with the plan. So in addition, a periodic verification of the HACCP system should be conducted periodically, once in a year, once in a 3 month. You have to verify your procedures to for the efficiency of the HACCP plan. So let's move towards the very last principle, the record keeping procedures. To establish documentation concerning application, you will determine what records are needed to show that the critical limits have been met and HACCP system is under control. Addressing the regulatory requirements and include records from the development of the system and the operations of the system have been kept for the maintain the HACCP system should include, for example, you have HACCP team, HACCP plan, your verification process, production records. What are you producing? And how, for example, if you are working in a biscuit manufacturing industry, you are manufacture or you are manufacturing. So this also includes in the record keeping procedures to assure the efficiency of your product. Wait for a while, there must be some technical issue with the internet. Am I audible to you? for a while. There is a technical issue. It is requested to all the participants maintain your mics. Okay, so we were discussing about the record keeping procedures. So these all are the record keeping procedures that we were discussing, that has a plan, critical control points, monitoring the corrective action that we have taken, and all the verification activities that have been done to improve the HACCP implementation or HACCP plan. Throughout the verification procedures must be recorded properly in the document form. Record keeping procedures, there are four types of HACCP records that include document using in the development of the plan. Both the HACCP plan must be recorded in a very proper manner. Records of CCP monitoring, records of corrective actions, and records of all verification activities documented. Review of the HACCP plan is the designing and running the HACCP scheme that should be revised whenever the food operation is altered. They have to have been taken during the HACCP implementation. If any kind of food operation or any kind of alterations, any kind of changes have been made in the food operation or food processing system. For example, if you are changing any protocol in the food process, so you have to change the HACCP plan accordingly to maintain the efficiency of the HACCP plan. The scheme should be reviewed from time to time. That is the regular reviewing of the scheme or HACCP plan, even when there have been no alterations that we have discussed already. Those who are asking questions, kindly wait for a while. We will answer one by one in a very calm manner. Kindly wait for a while. Okay, so this is all about the HACCP, its significance, and its implementation in the food industries, and how it is implemented, how corrective actions are taken for such hazards, or what are hazards. This is all about the HACCP implementation and food safety. Thank you so much for listening. Now there is a question answer session. Kindly inbox or kindly put your questions one by one, so we can answer you in a very proper manner. ask your questions one by one. Can you please repeat? Yes, I can repeat, but can you please specify what are you asking about? I think you are asking about the HACCP implementation. I have told you that HACCP is not only implement uh, on the cooking procedures only, or you can say the only the receiving area. HACCP is a plan which can be implemented throughout the plan which is implemented the supply chain. Not only specific procedures, HACCP must be implemented during the packaging. Metal detectors must be there to detect any kind of metal contaminants must not include in the package during packaging of the final product. So it is about, I think I have got your point and you have also got my point, if I am not wrong.
Assalamu alaikum everyone and good evening. Please let me know if you have any questions. I'll be happy to answer them. Ms. Sabah, can you please share the attendance link in the chat? See, verification system or there's a the difference between verification validation is that the verification ensures that the system or any type of component means the requirement which is specified, which is focusing on the design stage. On the other hand, the validation accesses the whether the final product satisfies the customer needs. So it's emphasizing the end result. For more clarification, I would like to say that the verification confirms the correctness, while the validation confirms the utility and customer satisfaction. Any more questions? Mm. Saira, you are asking about the packaging quality hazards only specifically? See, packaging quality hazards can be included physical damage during handling or transportation, the contamination risk are there, or issue with the labeling or the product information to mitigate all of these. packaging issue. I don't know why people don't. Okay, so as I was saying that the transportation handling could be included in the packaging quality hazards, and the issues with the labeling and product information also has to be looked after. So, equipment, on the other hand, you are saying there about the equipment reliability in the packaging. It involves ensuring that the machinery functions are consistently maintained during the product integrity. So, for that, you have to go for the regular maintenance, equipment monitoring, and training for the operators. They will contribute to the reliability. But there are also failures in the equipment that can lead to the production delays, defects, and safety hazards. So, it's important to stay proactive in the maintenance strategies. Okay, where is the chat? You're most welcome. Difference how where we implement hazard? That's a very good question. Wherever the hazards concern is required, or there is a chance of a food safety that you would like to give a good product to your consumers, you can apply the hazard there to identify the hazards, the three type or four type which are. Pradeep, that's been a long time you are working here and you are still asking me the question how to know HACCP is implemented in organization. You can go for the documentation. That's very simple. Or you can ask them if they are honest enough, they will let you know. If not, you can check the documentation. If not, you can still see the procedures, what type of procedures they are going through. Okay. So what is the difference between HACCP and food safety? Mm, See, food safety is particularly applied on the whole chain. HACCP is particularly focusing on the hazards only. Food safety is a concern of a different things, like for you can say uh, how you're placing the raw materials, how you're defrosting them, how the thawing process is. Food safety covers the entire chain, but if the HACCP, it is only particular area or the process. So that's the difference between food safety falls under the HACCP. They are somewhat similar together, but the difference is that food safety has a little bit more, or you can say much more, prolonged criteria as compared to the HACCP. Okay. Also, HACCP has also differences, but the main goal is same, to provide a safe food to the consumers. It depends on the industry, how large, how many processes are there, then you can control the hazard analysis. Pradeep, for example, you go to an organization, okay? You ask them what type of food safety measurements are you taking in your organization? They will tell you HACCP. That's easy to go. What do you like to know about PRPs? A general definition? A general understanding? See, PRPs are a fundamental food safety programs which are implemented in the food establishments to create a hygienic environment, and they are the set of the foundation of the HACCP. So PRPs such as sanitization, personal hygiene, facility maintenance, supplier control, all of these are few examples of many. So these are the PRPs, they also these all that I have mentioned play a very crucial role in preventing and minimizing the food safety hazard before the HACCP plan is applied. So before applying the HACCP plan, you have to go through the PRPs, which I mentioned them. Should I mention them again? Personal hygiene, facility maintenance, supplier control, sanitization. How to manage hazard? Yeah, I already answered that, depending on the process and the industry. So what type There are no tools of the HACCP. There are 7 principles and 12 steps of the HACCP. Which type of hazard or control? I didn't actually understood your question. What I'm trying to say that what type of hazards can be controlled by HACCP? Please elaborate your question. See, uh, GMPs are the good manufacturing practices. HACCP is already know. We have gone through today's session. So both have the framework focused on ensuring the safety and quality of the food and pharmaceutical products. Okay. So not to confuse yourself, see, GMP provides a very comprehensive framework for generally manufacturing the practices. Okay. While HACCP is a specialized system which is designed to identify and control these specific hazards in the production process. So many food and pharmaceutical industries integrate both GMP or HACCP to ensure that they are approaching through the quality and providing safety to the consumers. GMP is much more comprehensive, and it is for only general manufacturing practices. Okay. Any more questions? See, critical limit is a specific parameter or value that is set during the HACCP process that separates the acceptable from unacceptable conditions, right? You have gone through the acceptable and unacceptable definition in the HACCP today's session. So it is a measurable and observable value that helps in controlling or preventing identified hazards at CCPs in production process. For each CCP, there are critical limits established based on the scientific principles, regulation, and guidelines. So these limits define the boundaries within which the process should operate to ensure that the food safety is done. If it's not still clear, actually, I cannot speak for a longer time. That's why I'm trying to speak quickly. I'm not really feeling okay due to the issue that I had in my throat. So that's why I'm trying to speak quickly and slowly. There are many industries who doesn't require HACCP, but they require other standards. How to implement HACCP in a new organization? You have to start from the scratch. You have to understand the plan, scope of the industry, first of all. Then you have to see how you can apply the CCPs. Then you will go for the HACCP plan. Then you will start implementing it. All of the 7 principles has to be done before implementation. Oops. Let me see. There are some people who are on the YouTube. 2 are watching. Attendance certificate available. Uh, okay. Okay, so if there are any questions, so let me know, or shall we wind up today's session? I have payment issues, but this is a very